Hi, I'm Dr. Martin Bales, and we're here at Center for New Medicine and Cancer Center for Healing. And today I'm going to be performing an F-scan followed by a Firefly treatment. The F-scan is new technology from Switzerland, and in about 2 minutes, it scans the patient's body via an energetic testing mechanism, which you'll see in a second, and is able to detect many pathogens being parasites, bacteria, and viruses. What separates this particular technology from other energetic technologies in the past is it's fast. As I mentioned, it's about 2 minutes, and it actually comes up by name and tells which pathogen, which parasite, bacteria, or virus is present in the patient's body via the patient's immune system fighting said pathogen, and also the resonant frequency associated with it. Resonance, just to go back to high school physics, is the lady singing breaking the glass. So she's breaking the glass not by touching it or hitting it, she's taking it by singing, which vibrates at its resonant frequency, which allows it to be destroyed. And that's exactly what we're doing. We're taking the frequency that the F-scan tells us is associated with the pathogen, and we're going to be programming it into the Firefly equipment to do the Firefly therapy to destroy the pathogen via light. Okay, Ariana, so now we're going to be doing the F-scan. I'm going to have you hold this cylinder with your left hand. Great, okay. And then just go like this with your right hand. Perfect, okay. And just stay nice and relaxed, and you can talk to me during the scan if you'd like to, but just keep your hands right, yeah.
Okay.
So this process takes about 2 minutes, and then it'll print the results, and we'll go over what's on there. We'll see if it correlates with your symptomology, and then we'll choose which pathogen, because sometimes there's multiple ones on there, we would like to treat today.
Okay, awesome.
Okay, so the scan is completed, so we can. Just going to save this in your file. Okay, so this is the report that comes up, and it's a little bit contrary to other reports because usually what we're looking at is what's in red and brown, and in this one we're looking at what's in green, which is actually good in this case because there's a lot less greens than there are the brown and the red. So this comes up on about 75% of the patients I scan. It's called fasciculopus buski. It's a small intestine fluke. It's not a big thing. They're usually microscopic. But I think they're in the food supply because a lot of patients have this, and they can cause anything from just like constipation to bloating to gas, just any kind of gastrointestinal disorder. So you just had the one set come up, so we don't have to choose. I mentioned before, sometimes people have multiple and we have to choose which one. So we're going to give you a treatment for this intestinal fluke with Firefly now.
Awesome.
Okay.
Okay.
Okay, Ariana, so the Firefly treatment is easy. It doesn't hurt. It just feels kind of warm. And we're going to be issuing it for 10 minutes, administering it for 10 minutes around your abdomen, because that's where most of these bugs, and especially the intestinal fluke that came up, reside. So we're not just going to work on your small intestine, we're going to work on your whole abdomen, because it's my belief that they can be in the small intestine, but as I tell my other patients, it's all plumbed together, and I think they can wander if they want to. I say it's kind of like a PVC sprinkler system. They can go wherever they want. So why not just get everything? So I'm just going to have you lie back and just expose your abdomen from under the rib cage a little bit below your belly button.
Okay, sounds good.
Okay, the light is not a laser, but it's quite bright, so I'm just going to have you wear these safety glasses.
Okay, cool.
Okay, Ariana, I'm going to start the treatment. Right before I do, though, I want you to tell me if it gets too warm at any time when I'm going to what I call painting over your entire abdomen with these are the wands of the Firefly, and I'm going to be crossing the output streams to get the best permeation depth. Okay? Also, if you could let me know if you feel any movement when I'm over a specific area. We have had other patients report that, and then I'll concentrate right on that area.
Okay.
It's because it's our belief that that's when we hit the bugs with the resonant frequency, they don't like it and they start moving.
Oh.
Okay? How does it feel?
Pretty good.
Warm? Okay, not too hot though.
Oh, right now it's hot.
Warm. So the effects of this are going to last for 12 hours. And what this is really doing is stimulating, it's killing the bugs with the resonant frequency, but it's also stimulating your immune system to act on the different pathogens. And what we found, you only had one frequency group come up, but other patients have had 2 or 3 or even more come up. Well, I've given them a series of treatments, which is 3 treatments with the Firefly, and redone an F scan, and it didn't just get rid of 1 set, it got rid of 2 or 3 sets. And I think what happened is I was able to, unburden the immune system by killing one set of bugs that were associated with the frequency, and that allowed the patient's immune system to then go after the other sets. So we will give you 3 treatments, and then we will do an F scan for you again. Okay, so you had your first treatment. How did it feel?
Feels great.
Just kind of warm.
Warm and no problems.
Nice. Okay, and so as I mentioned before, I'd like to see you 2 more times. So we usually do a series of 3 within about a week and a half. So I could see you later this week, and then possibly the start of next week. And then we usually then, after, if we go by what your symptoms are and how you feel, but we can always do another F scan at some point in the future too, just to see if what the pathogen that came up on yourself is gone.
Okay.
A few things for your homework assignment. Okay, I don't want you to eat any sushi, especially raw, because I just think that that's a carrier for a lot of these pathogens, especially the intestinal fluke that came up on your scan, and also no raw items at restaurants, because I watch way too much Food Network and they have hidden cameras up and they just don't wash the lettuce and all of I'm talking like salads mainly. They don't wash a lot of that very well, and you just don't know, and you don't want to reinfect yourself if you're coming and spending your time and your money to see me.
Oh.
So you can have salads at home, that's fine, if you wash it, the lettuce and everything really well. And raw stuff at your house is fine, but just avoid it. Just not for the rest of your life, but just for now. Just for working the treatments, okay?
Okay, awesome.
Okay.
Thank you.
Thank you.